Right, so the Indian Ministry of Health and Family Welfare say there are 640 active COVID-19 cases in the country. 17 deaths have been reported so far, and 66 people have been cured and discharged from medical facilities. Now, more than 1.5 million passengers have been screened at airports. So if you look at state-wise data now, Kerala has reported the highest number of cases at 129. Maharashtra comes second at 127 cases. Now, most deaths in the country, that's 4 out of the 17, have been reported from Maharashtra. Now take a look at the global figures. The World Health Organization has reported more than 400,000 confirmed cases worldwide. More than 21,000 people have died so far, and nearly 200 countries or territories are affected by the coronavirus. Right, so now there are at least one graph that I want to share with you. Take a look at the next graph, for instance. Now, it relies on data collated again by the World Health Organization. It shows the number of cases reported by date. Now, it tells you how quickly the virus has spread throughout the world. So if we can bring up that graph in a moment, but if I can just quickly run you through the data coming up. There were only 574 cases worldwide. On 13th February, the number rose to more than 15,000. Remember, these are the number of cases reported on that particular date. Now, the next date we look at is 18th March. We'll pull up that graph in just a bit, but these are the information related to the global situation obtaining as we speak. There are at least 200 countries or territories that have been affected by the coronavirus pandemic. Right, next up, if we can bring up the bar graph, which tells you exactly how the virus has spread in the last several days. Look at that graph now. On 23rd January, there were only 574 cases, which shot up to 15,200 by 13th Feb, and progressively, exponentially, on 26th March, almost 50,000 cases were reported in one single day. That's the progress in the growth of the spread of the virus from January to 26th March. That's the information collated by the WHO. Now, again, I want to share some more information about the highlights and the headlines coming out from these developments. We'll pull up that graph in just a bit. First headline is the US overtakes China. The United States now has more confirmed cases than any other country. Next up, it has reported more than 83,500 positive tests so far. So the US clearly has reported more than almost 84,000 cases. So it has more number of cases than China and Italy. That's headline number one. Headline number two comes from India. Now, the Reserve Bank of India, that's India's central bank, has reduced the repo rate by 75 basis points to 4%. It's also lowered the reverse repo rate by 90 basis points to 4%. Now, the repo rate is a country's central bank lends money to commercial banks. The reverse repo rate is a rate at which it borrows from them. The third decision taken by the RBI is a moratorium on principal and interest on prepayment of loans for 3 months. So all these measures come a day after India's Minister Nirmala Sitharaman announced a 1.7 trillion rupee food security and money transfer package for the urban and rural poor. So that's the RBI decisions taken on 27 March as we speak. Moratorium on principal and interest payments for 3 months, which would come as a big relief for the urban middle classes as well. Right, moving on now to... All right, now to all the news from India. The Odisha government has taken the initiative to set up a COVID-19 hospital in the country. It'll have about 1,000 beds and will be functional in about 2 weeks. Odisha will become the first state in the country to set up such a hospital exclusively to treat COVID-19 patients. In the western state of Maharashtra, devotees view the Aarti at Mumbai Devi Temple in Mumbai on a television screen. Now, this is to again encourage social distancing and avoid crowds. Devotees gather outside the temple to see the Aarti being performed by priests. In another report from Maharashtra, shopkeepers and vegetable vendors have adopted ways to maintain a fixed distance between customers. People have generally welcomed this move. In Hyderabad too, vegetable sellers have taken steps to maintain social distancing to avoid the spread of coronavirus. Shifting focus to eastern India now, in West Bengal's capital Kolkata, roads remain deserted amidst the nationwide lockdown of 21 days. And in Arunachal Pradesh, essential services such as banks, ATMs, grocery shops, fruit and vegetable markets are open for specific hours. People and shopkeepers alike are maintaining social distancing and proper hygiene to avoid transmission of the coronavirus. Fruits and vegetable sellers in Itanagar have been advised to wear masks and gloves. The police has taken measures to avoid overcrowding in markets to buy essential items. In a unique initiative, a government sub-divisional hospital in Tripura's Udaipur has taken measures to encourage social distancing among patients and visitors alike. With footstep stickers put equidistantly from each other, the hospital ensures that social distancing is indeed being practiced. And finally, in Himachal Pradesh's Kullu district, people participated in a Hanuman Aarti from their balconies and terraces. And now to the segment in which we bring you ground reports from our correspondents across the country. With India in lockdown, the government in the northeastern Indian state of Meghalaya braces to fight against coronavirus. Markets, offices, commercial establishments and transport services are shut. But essential commodities such as food, vegetables, milk and medicine shops are open. Here's a ground report from my colleague Gautam S. Kumar in Shillong. Take a look.
With Prime Minister Narendra Modi announcing a nationwide lockdown for 21 days, states around the country have followed suit by intensifying their measures against COVID-19. Here in Meghalaya, the Chief Minister has promulgated a curfew wherein everything is off the road. As you can see, the streets of Meghalaya bear a deserted look with no people or vehicles. Shops are shut, with barring the exception of a few essentials like pharmacies. The curfew in Meghalaya is so extensive that even shops selling essential commodities like milk, bread or rice are shut today. However, the government has ensured that essential commodities will be delivered at your doors starting from tomorrow. I'm here standing in front of a pharmacy which is one of the only shops open throughout Meghalaya. How do you feel about the measures taken by both the Prime Minister and the Chief Minister?
I think that's our only option left for as of now, and the only advice to all people is kindly stay at home, be safe, protect your family and save yourselves.
And as a resident of Meghalaya, you're in full support of all the measures that are taken?
Yeah, that is the only way of heading towards it.
With the grit and determination showed by the people in the state and the guidance and leadership of both the state and the centre, there can be no doubts about who will win this battle between COVID-19 and the people of the country.
Now, mosques across the country have asked the devout to follow prohibitory orders to check the spread of coronavirus and offer prayers sitting at home. Now, some mosques have put up signboards at their gate requesting people to offer prayers at home, especially on Friday. My colleague Aisha Khanam filed this report from Bengaluru. Take a listen.
The country is observing lockdown to stay safe from corona, and stay home is the mantra to be safe from corona. All India Muslim Personal Law Board has advised people not to venture out and not to go to the mosque to perform prayers. Today is Friday prayers. Today is the first Friday after the lockdown, and people have been advised to stay home and pray. Here behind me, you can see my dad performing Friday prayers at home. He is an 80-year-old retired officer who loves to walk to the mosque every day for his prayers. But today, with the advisory, he is forced to pray at home, and he is praying at home and also advise his friends to pray from home. So it is the advisory to stay home, to stay safe, that will keep us safe from Corona. Remember, there is no place where there is no God. So stay at home and pray at home, and pray for those who are suffering from Corona, and also pray to God that He keeps us safe from Corona and also ends this disaster from the world. Aisha Khanum, DD News, Bangalore.
All right, shifting focus from Bengaluru to New Delhi now. Civil defense personnel are playing an important role in the fight against COVID-19. My colleague Tapas Bhattacharya spoke to some civil defense personnel in East Delhi to take stock of the situation. Listen in.
Lockdown has come into effect from midnight, and Prime Minister Narendra Modi has made a passionate plea to everybody to stay inside, stay indoors and be safe. I've got with me a few people who are making sure that this happens. These are civil defense personnel who have been chosen by the district magistrate. These people have been given the task of stopping people who are going out, and also sensitizing them, telling them that these are the things that needs to be done. I've got with me a person here right now. आपका शुभ नाम क्या है?
मेरा नाम चरणजीत कौर है सर.
Her responsibility is to make sure that she has these hand sanitizers. She takes it to the people who are going out and tell them to sanitize their hand, and that is what she is doing. There's another person who is here. आपका शुभ नाम बताएं.
नागेंद्र पाल सिंह.
Nagendra Pal Singh's duty is to make sure that the pamphlets that are there right now, you can see these are the pamphlets. It has all the information that is required to provide the general public exactly what needs to be done. So the pamphlet provides that information, and they tell them, explain them that this needs to be done.
बता रहा था इनको बारे में कि इसके लक्षण क्या होते हैं. सर दर्द होता है, सांस लेने में तकलीफ होती है, छींक आना, खांसी, बुखार, किडनी में दर्द, आखिर में किडनी फेल हो जाती है.
So you see that these are the unsung heroes that we talk about. These are unsung heroes from the country, from the capital, who are making sure that Prime Minister Narendra Modi's social distancing message reaches to each and every person. This is Abush Bhattacharya, Doordarshan News, Delhi.
Right, time now for the good news segment. With India in lockdown, people have come up with innovative ideas to help each other during quarantine. In Ludhiana, a town in the northern Indian state of Punjab, police distributed food to the needy. And not to be outdone, their counterparts in the northern Indian state of Uttar Pradesh did their bit too. The personnel deployed at Civil Lines police station in Prayagraj prepared food for the needy and distributed it in the wake of the coronavirus outbreak. So the message in all of this is clear: hope blooms amid gloom. There are many out there like them who are actually making a difference on the ground. It's worthy of applause. Now, police in Punjab and Uttar Pradesh are not alone. Social workers in West Bengal have risen to the occasion too. In Kolkata, some social workers distributed food to destitutes at the Dum Dum railway station amid the coronavirus lockdown. Now, Ramanand Sagar's epic drama Ramayana, which first aired on Doordarshan way back in 1987 and gained instant popularity, is returning to TV again. Information Broadcasting Minister Prakash Javadekar tweeted to say that Ramayana will air on DD National twice a day starting 28th March. In a tweet, he said, and I quote here, "Happy to announce that on public demand, we are starting retelecast of Ramayana from 28th March on DD National. One episode in morning, 9 a.m. to 10 a.m., another in the evening, 9 p.m. to 10 p.m. unquote. Right, time for a very short break. When we come back, we'll get you all the international news, plus tips on how to cope with the lockdown. Keep watching DD India. Don't go anywhere.
इनमें से एक है आपका डिटर्जेंट और एक फेना। अब आप बताइए कौन सा बेहतर है? ये है ज्यादा सफेद फेना।
ब्लाइंड वॉशिंग टेस्ट में 100 में से 70 लोगों ने फेना सुपर वॉश को अपने डिटर्जेंट से बेहतर पाया है।
अब आप भी लीजिए फेना सफेदी चैलेंज और खुद कहना फेना ही लेना।
ये गर्मा गर्मी धक्का मधक्की, प्यास एक है सबकी, टेंशन का स्ट्रॉ हटा और एक सांस में खटक जा। हमारा कोल्ड ड्रिंक, हमारा कोल्ड ड्रिंक, हमारा कोल्ड ड्रिंक, अमूल लस्सी हमारा कोल्ड ड्रिंक।
125 करोड़ से ज्यादा आबादी का देश, तो लगभग इतनी ही जेबें भी होंगी, पर एक वीआईपी नंबर है जो लगभग हर एक जेब में पाया जाता है। उसे दिखाओ तो बैंक में खाते खुल जाते हैं आसानी से, अपने हक के पैसे सीधे खातों में आ जाते हैं आसानी से, बैंक हमारे दरवाजे तक पहुंच जाता है, इनकम टैक्स वेरिफिकेशन भी हो जाता है आसानी से। इसीलिए कहते हैं भैया
आधार अपना लो,
फायदे में रहोगे।
पक्की होगी बुनियादें तो हंसे हिंदुस्तान होगा। पहले करो शुरुआत करो, करो तो पक्की बात करो, पहले करो शुरुआत करो, करो तो पक्की।
वंडर सीमेंट, एक परफेक्ट शुरुआत।
बैटिंग तो अर्जुन कर रहा है, तो सब गोलू के लिए क्यों चीयर कर रहे हैं? वो तो घर पर बैठा है।
अरे तुम्हें नहीं पता, वो इसलिए नहीं आया ताकि हमें इन्फेक्शन ना हो।
नोवेल कोरोना वायरस बीमारी को फैलने से रोका जा सकता है। बुखार के साथ खांसी और छींक होने पर सार्वजनिक जगहों से दूर रहकर इसे फैलने से रोक सकते हैं। अपनी सुरक्षा के लिए हमारी मदद करें। अगर आपको खांसी, बुखार या सांस लेने में तकलीफ हो तो तुरंत नजदीकी स्वास्थ्य केंद्र जाएं या हेल्पलाइन नंबर 911123978046 पर संपर्क करें।
आज तो पार्टी चाहिए। चैंपियन के साथ सेल्फी लेंगे।
आइडिया, यही करते हैं पार्टी।
पिज्जा पार्टी। ये चल अपना कार्ड और पिन दे।
मेरे कार्ड की डिटेल्स मैं खुद ही डालूंगी। आरबीआई कहता है अपना पिन, ओटीपी, सीवीवी या इंटरनेट बैंकिंग पासवर्ड किसी के साथ शेयर ना करें। ऑनलाइन बैंकिंग सिर्फ अपने कंप्यूटर, मोबाइल और सिक्योर नेटवर्क से करें।
बाय गर्ल्स, कहाँ जा रही है? सुना नहीं, नो शेयरिंग।
आरबीआई कहता है जानकार बनिए, सतर्क रहिए।
दुनिया में कई काम बड़े मुश्किल है, जैसे कि चंद मिनटों में चांद पर पहुंचना, टूथपेस्ट में पेस्ट को वापस डालना। और भैया एक काम है जो है बेहद आसान। अरे भाई वही आधार कार्ड में अपना एड्रेस अपडेट करना। इसके लिए बस आपको UIDAI की वेबसाइट पे जाना है, अपना आधार नंबर डालकर OTP जनरेट करना है, फिर फॉर्म में OTP डालकर अपडेट एड्रेस कर कंफर्म करना है, और लो हो गया आपका आधार में एड्रेस अपडेट। आप भी आधार अपना लो, फायदे में रहोगे।
जिसको पीते ही ऐसा लगता है जैसे
जन्नत, जिंदगी,
सुब्लाइम, फ्रेश,
ऑसम, संतुलित,
बहुत मस्त यार। पैकेट से कैसे भी?
अमूल मस्ती बटर मिल्क, देसी रिफ्रेशर।
Welcome back. You're watching #Tracking COVID-19, your one-stop destination for all information related to COVID-19. Let's now take a look at some world news. After Prince Charles, now UK Prime Minister Boris Johnson has tested positive for coronavirus. Johnson put out a tweet, and I quote here, "Over the last 24 hours, I've developed mild symptoms and tested positive for coronavirus. I'm now self-isolating, but I will continue to lead the government's response via video conference as we fight this virus. Together, we will beat this. #Stay home, save lives," unquote. He posted video as well. Take a listen.
Hi folks, I want to bring you up to speed with something that's happening today, which is that I've developed mild symptoms of the coronavirus. That's to say, a temperature and a persistent cough. And on the advice of the Chief Medical Officer, I've taken a test. That has come out positive, so I am working from home, I'm self-isolating, and that's entirely the right thing to do, but be in no doubt that I can continue, thanks to the wizardry of modern technology, to communicate with all my top team to lead the national fight back against coronavirus. And I want to thank everybody who's involved. I want to thank, of course, above all, our amazing NHS staff. It was very moving last night to join in that national clap for the NHS. But it's not just the NHS, it's our police, our social care workers, teachers, everybody who works in schools, the DWP staff. An amazing national effort by the public services, but also by every member of the British public who's volunteering. Incredible response. 600,000 people have volunteered to take part in a great national effort to protect people from the consequences of coronavirus. I want to thank you. I want to thank everybody who's working to keep our country going through this epidemic. And we will get through it. And the way we're going to get through it is, of course, by applying the measures that you'll have heard so much about. And the more effectively we all comply with those measures, the faster our country will come through this epidemic and the faster we'll bounce back. So thank you to everybody who's doing what I'm doing, working from home to stop the spread of the virus from household to household. That's the way we're going to win. We're going to beat it, and we're going to beat it together. Stay at home, protect the NHS, and save lives.
Right, I cannot emphasize it enough. Please take proper care of yourself. Remember, there is no vaccine or medication available yet for COVID-19. So isolation is of paramount importance. Do not take it lightly. All right, moving on. Prime Minister Narendra Modi participated in the G20 Extraordinary Virtual Leaders Summit to discuss about issues related to COVID-19. In a statement, G20 nations pledged a united front in the fight against the coronavirus pandemic and said they were injecting $5 trillion into the global economy to counter the impact of the crisis. Now, the Prime Minister noted the alarming social and economic cost of the pandemic. He said 90% of the COVID-19 cases and 88% of the deaths were in G20 countries. The G20 accounts for 80% of world GDP and 60% of the world population. He called on the G20 to come out with a concrete action plan to fight the global pandemic. He underscored the need to put human beings at the center of a collective global vision of prosperity and cooperation, freely and openly share benefits of medical research and development, and work together to reduce economic hardships resulting from COVID-19, particularly for the economically weaker sections of society. And he called on the leaders to help usher in a new globalization for the collective well-being of humankind and a multilateral fora focusing on promoting the shared interests of humanity. And that's a wrap on this special broadcast, but news continues here on DD India. You can take the latest updates from our social media, mobile and digital platforms. Thanks for watching. Bye-bye. Right, so these are the visuals from the United Kingdom of people taking to their balconies and doorsteps to applaud health workers who are battling the spread of coronavirus. Encouraged by celebrities, politicians and even the British royal family, Britons dropped their usual reserve to take part in the moment of unity with the country's national